Good morning, everybody. It's Kayla and Michelle from Friendship, and today we want to talk about incident reports.
So I'm going to start off by talking about when you find your resident on the floor, in the hallway, she's fallen or he's fallen. The first thing you do is you don't move them. You need to do a complete assessment before you move them. It can be a devastating mistake if you move somebody who may have had a pelvic fracture, and then when you move them, you now may have caused some uncontrolled bleeding, or a spinal injury or a neck injury. So really, you have to do a full assessment. And when in doubt, and you're not sure, you just have to call 911 and have somebody come out there and then take them to the hospital to be assessed. So you walk in, you find your resident on the floor. And these are in no certain order. Obviously, you're going to check for, their alertness. Do they know where they are? Do they know what day it is? Assessing for head trauma first, especially if it's an unwitnessed fall. Checking their vital signs, apical and radial pulses. You would do an orthostatic once if you were able to get them back in bed. That would be when you could do an orthostatic to make sure there's not some syncopal issues going on with their blood pressure. Always check a blood glucose, even if they are non-diabetic. Sometimes you will catch somebody in a hypoglycemic episode and you never knew they were diabetic. They're pre-diabetic. So that's important. Check the skin for pallor, trauma, circulation, abrasion, bruising. And bruising could show up 2 days later. So that's why continuing ongoing assessment and continuing updating our incident report is important. Check for central nervous system changes for sensation, movement, and lower extremities. Are they able to move it? Can they feel it? Can they squeeze your hands equally? Assess the current level of consciousness and determine whether the patient has had a loss of consciousness. Look for subtle cognitive changes. Check for pupils and their orientation. Also, make a mental note of how you found them on the floor. Whether was the leg rotated out, was it rotated in, was the knee, in an abnormal position? Does it look like there's shortening of an extremity? Is there pelvic or spinal pain? And then note any pain or points of tenderness, because that number will most likely not be the same. It'll change and be very fluid throughout the next probably 4 or 5 days, their pain levels. So be aware of any tingling of extremities, back pain. Don't hesitate to call 911 and talk to all your witnesses, which Kayla is going to go over in more detail.
Okay, so now we're going to go into the incident report. Hopefully you have a piece of scratch paper or whatever you wrote all of this information down on so that you can bring it back at the end of your shift and do your incident report. To initiate the incident report, it's in risk management. You're going to select a new incident report. We are going to choose our mock resident, Miss Bath. All right, and this was a fall. And the location of the fall, in this case, it was the room, but residents fall all over the building, and do be specific if the resident fell in the shower or the bathroom. Okay. So under the first tab, the details, the top part is the nursing description, and that is where you're going to take all of the information Michelle went over in the assessment, and you're going to lay it out. We want to start with a detailed description of how you witnessed the resident when you came in the room. Were they laying parallel to the bed with their head propped up on the dresser? Were they just sitting on their bottom right next to the bed and they just appeared to scoot onto the floor? Did they have the walker pulled over them? Was there clutter all over the floor? Had they tipped their water bottle over on top of themselves? This is a really important point to note if they had been incontinent or not. Next, you're going to go through your assessment, so what your findings were, what their vitals were, what their neurological status was there any pain, and then once you have established that there was no injury or you have called 911 because there was injury, You can get the resident up off the floor with a Hoyer with no injury with 2 staff members, or you can stay with them until the paramedics arrive. In this section, you really want to know what was on their feet. Was their call light on? Was their care plan followed? Where was their pressure alarm? If they had been walking and they fell in the doorway, where was their walker? Did they have it with them? Did they leave it by the bed? If you know that they need a walking boot and they didn't put it on, was it on the floor? Was it on the other side of the room? Was it within reach? If they say that they just slid from the bed to reach the remote, was it because it was left on the sink, or did they drop it on the floor? So the next section is the resident description. This is really important. Not all residents will be able to give you a description, obviously. If they are confused, they might not be able to say at all what happened, but if they can tell you that, oh, I just slipped on the floor, or oh, I forgot to put my call light on and I got up and went to the bathroom, whatever it is, it's really important to put it in quotes in that section, specifically as they said it. And the description of actions taken is just the short list of the things that you did. So we're going to start with assessed resident for injury, assist resident to bed with Hoyer, initiated neuro assessment flow sheet, because if it is an unwitnessed fall, we need to do neuro checks on the flow sheet. Notified family, MD, nurse managers, monitored and administered Tylenol for mild pain, whatever it is that you did to keep the residents safe. And if there was anything you did to follow up for the fall, like you chose to put a pressure alarm on them, you requested a room change to put them closer to the nurse's station, that'll be in the description of actions taken.
Also, back up on to the nurse description, make sure that you are not using any negative words. The patient was lazy, or the patient was irritated, or they were difficult or demanding. Make sure you're not putting any negative things about them in there, because really that reflects on you, and the jury and the judge and attorneys or the family will look at that and immediately think that you have a problem with that resident, that you don't like them. That's how it will come across, regardless of how you truly feel about them. So don't say that the resident was saying strange things or acting weird, because this can mean something different to every single person. So instead, record exactly what the patient said, did, and don't comment on what you thought about it. Be specific. Don't use abbreviations. If the patient's in pain, for example, don't just record that the patient appears to be in pain. Record why the patient's in pain. For instance, the patient requested pain medicine after stating that she felt low back pain radiating to her right leg. 6 out of 10 on the pain scale, denies any numbness or tingling. Color of extremities is pink, warm to the touch, no edema noted. And that's what you want to document. And you also want to put in there, and I think you've talked about prevention, really talking about what you did or what was in effect to prevent the fall, because we should get credit for that.
Right.
And show that we did do a lot of different things to prevent this fall, and they can still just happen. That's just how it is.
Yeah.